classification of ovarian cancer. Okay, classification of ovarian cancers. There are three major subtypes of ovarian cancer, and each one of these subtypes has its own subtypes. Okay, so we have the epithelial ovarian cancer, we have the germ cell tumors, and we have sex cord or hormonal tumors. Okay, let's start with the epithelial tumors, which constitute about 80 to 90% of all ovarian tumors. So it is the most common among all. Okay, and it is also the most dangerous. What are the subtypes of epithelial type ovarian cancers? The first subtype, and the most common also, is serosal cancer. Okay, it constitutes again 80%. It is the most common, and it is the worst prognosis. Okay, it has the worst prognosis. The serosal type epithelial cancer of the ovary is or has a good response to chemotherapy. Okay, but the problem that this cancer back rapidly. So you treat with chemotherapy, the cancer disappears for a while, then it backs. Okay, so this is this serosal type. The second type of epithelium ovarian cancer is mucinous cancer. Okay, and mucinous type is actually the most benign type. Okay, it is like GI cyst, and it is the most benign. If it was malignant, or if it is malignant, it is not actively growing a tumor. Okay, so it has no good response to chemo or radiotherapy. In serous type, we said that it has a good response to chemo, but it recurs. Okay, but in mucinous type, it has no good response to chemo and radiotherapy. So the best choice is to deliver it intact. Okay, the mucinous type comes as a gelatinous cyst. Okay, and the best way of treatment of this gelatinous cyst is to deliver it intact, and be careful not to rupture it, because if you rupture the gelatinous cyst, it will make some seeding. Okay, so serosal type, mucinous type, and the third type is mesonephroid type. Mesonephroid type is very aggressive type of epithelium ovarian cancers. It affects kidney, and it is very aggressive. Okay, after mesonephroid type, we move to endometrioid type. It is just like mucinous, but with no GI association. Okay, just like mucinous cancer of the ovary. So serosal, mucinous, mesonephroid, endometrioid, and the last subtype of the epithelial type cancer is a clear cell carcinoma. A clear cell carcinoma is very, very aggressive, and it is the only one with extra abdominal masses. But remember always that serosal type is still the most aggressive one. A clear cell is also aggressive, only a type of ovarian cancers with extra abdominal masses. Okay, it responds poorly with chemotherapy. So the treatment of choice here is radiotherapy, and every case has its specificity, but in general radiotherapy is good with clear cell cancer. Okay, so epithelial serous type is has good response to chemo, but recur. A mucinous type has no good response to chemo and radio. A clear cell type has no good response to chemo, but good response to radio. Okay, this is about epithelial cancers. The second types of ovarian tumors is germ cell tumors. Okay, germ cell tumors occur in young age. I forgot to say that epithelial cell tumor is most common in old age, but germ cell tumor is most common in young age, okay, and it also has some subtypes. The first one is dysgerminoma. Dysgerminoma has no specific markers, okay, there is no specific tumor marker, but LDH is the tumor marker of dysgerminoma, though it is not specific to it, okay. Teratoma is the second germ cell tumor, okay. Teratoma is the most common benign tumor. It's all over most common benign tumor of the ovaries, okay. It constitutes three layers: the endo, meso, and ecto tissues, okay. So we can see teeth, we can see hair, and we can see other tissues, all types of tissues in teratoma. To differentiate between malignant and benign teratoma, the malignant is immature teratoma, okay. The neural tissue is used to differentiate between benign and malignant teratoma. Once the neural tissue is there, then it is malignant teratoma, okay, immature or malignant teratoma. The last type of germ cell tumors is choriocarcinoma, and the specific marker of choriocarcinoma is beta HCG. I will talk in details about choriocarcinoma when we move to gonadotrophoplastic diseases, okay. So now I would just want you to know that beta HCG is the tumor marker of choriocarcinoma. The third type of ovarian cancer after epithelial and germ cell tumor is 6-cord or hormonal tumors, okay. This is a functional tumor that secretes hormones. It's subdivided to granulosa and thecoma. Okay. Granulosa is the most common type of 6-cord or hormonal tumors. It secretes estrogen, and the specific tumor marker of it is inhibin, okay. So inhibin with the granulosa that secretes estrogen, and it's the most common, okay. The second type is thecoma, and thecoma secretes androgen, okay. So it makes symptoms of hyperandrogenism, okay. For example, hirsutism, signs and symptoms of virilism, okay, deep sound. So it has symptoms that and signs that are close to the symptoms and signs of PCOS. So how can we differentiate? Thecoma has rapid onset, okay, in opposite to PCOS, which has a slow onset, okay. These are the types and the subtypes of ovarian cancers: epithelium, germ cell, and 6-cord. Epithelium with serosal, mucinous, endometrioid, mesonephroid kidney, a clear cell, okay. And the germ cell tumor, dysgerminoma, teratoma, choriocarcinoma, 6-cord or hormonal tumors, granulosa, and thecoma, which secretes androgen, and granulosa, which secrete estrogen with a specific marker of inhibin, okay. Now let's move to talk about staging of ovarian cancer. Actually, I don't want to talk in details about staging, but the thing I want you to know is that the staging of ovarian cancer is surgical staging, and the most common presentation or the most common stage that presents is a 3C, which is an advanced stage, okay, because ovarian cancer is a silent disease that comes with no symptoms. So most of patients will admit with a 3C stage, okay. The 3C stage is upper abdomen fiction with more than 2 centimeter nodules, okay, more than 2 centimeter nodules. You have, in the case of a 3C tumor, or in the case of more than 2 centimeter, to remove the whole pathology radically, okay, with lymph node and blood vessels. You have to remove the pathological tissue radically, okay, because inadequate surgery is associated with bad prognosis. The most common cause of bad prognosis of ovarian cancer is inadequate surgery, okay. This is about all I want you to know about staging, okay. What about fertility reserving in ovarian cancer? To reserve fertility, you can reserve it just in 6-cord tumor and in germ cell tumor, okay. We can't reserve fertility in epithelial type, okay. How can do we reserve fertility? With using chemo and radiotherapy, which are effective as surgery, but it doesn't kill the ovaries, so it reserves fertility. But you have to take care that in the cases of recurrency, surgery is must, okay. Okay, so let's just have a brief talk about chemotherapy. Even before surgery, when we plan to do a surgery, chemotherapy is given, okay, to debulk the tumor. We give chemotherapy to debulk the tumor. We give 3 cycles of chemotherapy before the surgery and 3 cycles post or after the surgery. What chemotherapy are given? Carboplatin is one choice with side effect of bone marrow suppression and fatigueness. Cisplatin is also a choice with with the side effects of nephro, auto, and neurotoxicity. Cisplatin is toxic to nephro, neuro, and auto systems, okay. And the last and the most common type used is paclitaxel, okay. Paclitaxel also has some side effects like complete alopecia and neurotoxicity, but now it is used extensively, okay. Paclitaxel is also used with endo and cervical cancer when nothing works, okay. We can also give intraperitoneal cisplatin to improve ovarian cancer. But the problem with intraperitoneal cisplatin that it has GI symptoms, abdominal pain, which is very bad, okay. And that question the use or the usage of cisplatin intraperitoneally, okay. It's a brief talk about chemotherapy and about fertility preserving and about staging of ovarian cancer. Thank you for watching the video of ovarian cancer. See you in the next lecture. Thank you very much.